So what I'd like to talk about next is how people can increase the probability of a successful fertilization, focusing both on the components from the male side and from the female side. And I'm mainly going to couch this discussion in the context of the so-called natural method of sexual intercourse and ejaculation in vivo, right, within the female. But I will also touch on some parallel themes as it relates to in vitro fertilization and intrauterine insemination. Okay, so the idea here is that we want the maximum number of high quality sperm, that is rapidly forward motile sperm that are of the correct morphology, that is shape. That's going to require a lot of mitochondria in the mid-region, a well-shaped head, so it's going to be an oval-shaped head. The tail is going to be a single tail, not multiple tails. These aren't going to be the twitcher type of or immotile type of sperm that are either twitching in place or aren't moving forward. All of those components are going to be essential for increasing the probability of fertilization. But of course, there's the female side of it too, which is that ovulation occurs on just one day during the menstrual ovulatory cycle, and that egg will be available for fertilization for approximately 24 hours. Now, keep in mind that the sperm can survive within the vaginal duct and within the area around the cervix and within the uterus and along the female reproductive tract for anywhere from 3 to 5, or it's even been described as up to 7 days, but generally it's going to be about 3 to 5 days. Now, most women can figure out the day of their ovulation by counting the total number of days of their typical cycle. And this is where it's really useful to have a cycle that's of more or less regular duration, or rather of more or less regular length. So as we talked about earlier, if somebody's cycle is 21 days or 25 days and it's 21 or 25 days consistently, or even 30 days consistently, that's going to be a far better scenario to favor fertilization than if it's 20 days 1 month and then 21 days the next month, but then suddenly, 30 days and then suddenly 35 days. Those varying durations of the ovulatory cycle make it very hard, obviously, to time and understand when ovulation is going to occur. So regular duration ovulatory cycles are the ideal circumstance. And they're the ideal circumstance because even though the egg is only available for fertilization for a few days, those sperm can survive for some period of time, which leads to the issue of how often should couples be having intercourse. And here I'm referring specifically to intercourse with ejaculation. How often should couples be having intercourse around the time of ovulation if the specific goal is successful fertilization of the egg and the creation of a baby? Okay, this is leaving aside all issues, which of course are interesting issues related to how often people are having intercourse, whether or not there's ejaculation every time they have intercourse or not, for sake of pleasure or for sake of pair bonding and pleasure, or for sake of any number of other potential goals of intercourse. Here, I'm only referring to intercourse as it relates to the goal of fertilization of the egg. Okay, so knowing what we know about spermatogenesis and the fact that ejaculate is going to contain a certain concentration of sperm, but that within that ejaculate, some of the sperm will be older and less healthy, and some will be optimally mature, and some might even be a little bit immature, although there's a tendency for the immature sperm to not have yet exited the seminiferous tubules, gone into the epididymis and vas deferens. But given that the ejaculate contains sperm of varying ages and therefore varying quality, and given that with each successive ejaculation in a short period of time, there's going to be a decrease in the concentration of sperm per milliliter of semen, of ejaculate, we can make some good arguments as to how often couples should have intercourse with ejaculation around the time of ovulation if the goal is to fertilize. If ovulation occurs on, for instance, day 14 of a cycle, and here we're using the kind of standard average of 28 days of the cycle, but for some people with a 30-day cycle, that could be day 15, or with a shorter cycle, it could be day 12, for instance. But given a 28-day average cycle, let's say ovulation occurs on day 13 or on day 14, and typically would occur on day 14 of a 28-day cycle. Well, then, given how long sperm can survive inside of the woman, you might think that the optimal strategy would be to have as much intercourse with ejaculation in the 3 or 4 days leading up to ovulation. Hope that those sperm have swum as far as they possibly can and will encounter the egg just as soon as possible after it ovulates. It turns out that's not the optimal strategy. The optimal strategy is really to maximize the concentration of healthy sperm within each ejaculate and to really center that around the day of ovulation. So what this involves generally, and what the typical recommendation is to abstain from intercourse with ejaculation about 2 or 3 days out from ovulation. And then on the day prior to ovulation and on the day of ovulation to essentially introduce as much semen and ejaculate into the reproductive pathway of the female as possible. Okay. Now, that's the general recommendation that the OBGYNs and the urologists that I spoke to gave, but you will also hear a different strategy. It's only slightly different, but the different strategy involves trying to maximize the concentration of healthy sperm within each ejaculate, with the understanding that with each subsequent ejaculation over about a 24-hour period, that there's going to be a dramatic reduction in the concentration of sperm. What that means is that if a couple, for instance, were to have intercourse with ejaculation many times on the day prior to ovulation, yes, that will introduce a lot of sperm into the reproductive pathway of the female, but what it means is that on the day of ovulation, if they were to have intercourse, the number of high-quality sperm that will be available to the egg will be greatly diminished. And if none of the sperm that were introduced in the day prior manage to fertilize that egg, well, then essentially chances are off that there will be fertilization, or they're greatly diminished. Rather, if they're having intercourse with ejaculation once or twice on the day prior to ovulation, and then a maximal number of times with ejaculation on the day of ovulation, that itself can maximize the probability of fertilization. So which strategy is optimal? Should couples have as much intercourse with ejaculation on the day prior to ovulation and on the day of ovulation? Or should they have intercourse on the day prior to ovulation, but not so frequently that it diminishes the concentration of sperm, and then allows for intercourse with the maximum number of ejaculations on the day of ovulation? You really hear it both ways. And what this really boils down to is, frankly, that nobody knows.